It looks like she had 2 measles shots already, so we don't have to deal with that today.
4-year-old Kennedy may be a little girl, but she's about to take a big step. Kennedy is receiving the vaccinations that will enable her to begin pre-kindergarten.
Her shot record expires on the 8th.
I'll get you another one.
Making sure shot records remain accurate and updated is not always easy.
Frankly, the current immunization schedule is complicated. I mean, we now are up to giving vaccines to prevent 14 different diseases in the first few years of life. There's another couple vaccines that we give in adolescence. There are also different vaccines that we give to adults, including elderly adults. So it's confusing.
Confusion that increases when records get lost and when families move and children change schools.
They change schools and the school needs a new vaccine record. Well, where is it? And who has it? And maybe my pediatrician retired and I can't get those records anymore. This happens to us quite frequently.
According to the Centers for Disease Control and Prevention, by 2 years of age, over 20% of the children in the U.S. typically have seen more than one healthcare provider. This can lead to a paper chase for parents and schools.
Parents don't always present with the document that we need, meaning the immunization document.
Computerized databases called vaccine registries help parents, providers, and schools deal with what used to be a daunting task by consolidating immunization information into one reliable source.
And what a vaccine registry allows families to do and pediatric practitioners to do is to know which children have had their vaccines when.
Florida's online immunization registry is called Florida Shots. Florida Shots is secure, confidential, and free.
I found that My Florida Shots has been a wonderful tool.
Florida Shots has improved my life in terms of work a lot.
They aren't the only fans of Florida Shots. The Florida Pediatric Society and the Florida Medical Association, among other organizations, have endorsed it. Florida Shots has also been honored with several national awards. Another measure of Florida Shots' success: more than 110 million shot records have now been uploaded and processed through the Florida Shots Registry. Those who have seen the benefits of Florida Shots have a message for healthcare providers and parents.
As a school nurse, I would strongly recommend, or maybe even plead with physician offices, healthcare providers, if you currently do not use My Florida Shots, please seriously think about doing so.
Florida Shots is a program of the Florida Department of Health, Bureau of Immunization, and is supported by the Centers for Disease Control and Prevention. One of the ways Florida Shots works to maintain high immunization levels is by providing reliable record keeping that's often hard for parents to keep up with.
Parents of children who are 2, maybe 3 years old, in the time when the children are still young and you're carrying around a diaper bag and you have everything with you, it's hard for parents to imagine that they will ever forget their vaccine card. So they may not realize how useful something like a vaccine registry can be to them.
Dr. Judy Schechter with the University of Miami's Miller School of Medicine says Florida Shots eases the record-keeping burden on parents and schools.
The schools, the parents, the camps where kids go have a computer printout where the dates are all nice and clear. They don't have to rely on our bad doctor handwriting, and so things are right there and ready for them.
We often receive handwritten documents from a physician's office or another healthcare provider type clinic situation. They're not always clear, they're not always concise, you're doing a lot of hunting.
Paula Alford with the Florida Association of School Nurses says she has seen her share of sloppy immunization records, but she says Florida Shots earns an A+ for reliability.
To have that clear and concise document from My Florida Shots, there's no guesswork involved. Ideally, we have quite a few students that we are servicing, and time is of the essence.
Time is of the essence, not just for schools and daycares, but also parents and healthcare providers, which is why Florida Shots' ability to determine correct dosing schedules is critical. It helps ensure that children get the right vaccines at the right time.
It also has certain alerts that tell you when a vaccine is overdue. Now, we as physicians know what that is, and we can look at those dates. But if other people are looking at it who might work with us, if a school wants to look at it, there's an alert to say that something's overdue.
And as children grow, Florida Shots keeps them on track.
It's also a record for the entire lifespan. But probably the biggest reason that vaccine rates are not complete in teenagers is that parents don't know that they need vaccines. So many of them were carrying around their little yellow card, and thank goodness we now have Florida Shots to help augment that.
We don't want anyone getting a dose of a vaccine if they don't need it.
Dr. Andrew Kroger with the CDC says while vaccine registries like Florida Shots help identify immunizations that may be due or overdue, they also prevent unnecessary shots.
It can avoid duplicate administration of doses, which saves a lot in terms of time for patients and parents.
It makes it a lot easier with it already being the information already being in the system.
Barbara Ocasio is an office manager who uses Florida Shots to help patients follow the correct shot schedule. It also helps parents in a pinch.
Especially kindergartners, they call in the day that school starts or the day after school starts. I'm getting ready to kick my child out because I don't have my immunization form. We can get it to them in no time. Now if they call and need a form, we can have it for them in a few hours. It's that long. It used to take us at least 24 hours or longer before we can get the form to them because we had to fill them out by hand and then give them to the doctor to sign them.
Florida Shots also makes life easier for families on the move. Change doctors, change addresses, Florida Shots keeps up. When shot records are entered in the Florida Shots database, they become available to any medical provider in the state, allowing your healthcare providers to exchange important immunization information.
Children move from school to school and from school district to school district, and having a universally available, if you will, within the state database is just wonderful.
But vaccine registries like Florida Shots go far beyond the personal. They also help improve public health planning.
It basically allows public health to track vaccine doses, measure coverage, measure the efficacy of vaccination programs, and allow efficient ordering.
And that efficient ordering can be key to helping keep provider costs, and by extension, patient costs, down.
It can save a lot in terms of money, in terms of paying for vaccine doses.
While Florida Shots works to ensure that providers can access immunization information, it also safeguards that information. The Florida Shots Registry is located on a secure server with password-restricted access and the latest encryption and firewall safeguards. All authorized accounts are given access to the system only after the Bureau of Immunization has verified that they have appropriate licensing in the state of Florida and they have completed training.
It's also incredibly private. Like any health information that we have, it is protected by both state and federal law so that your child's information is not getting out to whoever wants to look at it.
Florida Shots is also there in the event of an emergency. Because records can be accessed online around the clock, they're available anytime or anywhere they're needed. In a medical emergency, hospital emergency rooms can access Florida Shots for your child's up-to-the-minute immunization status.
But let's say you had to go to the emergency room because you had your foot got cut when you're outside playing. You don't know when your last tetanus shot was. Well, by having a vaccine registry, the doctors in the emergency room are able to find out, well, what vaccines have you had and what are you missing?
While Florida Shots can provide help during medical emergencies, it can also be a crucial link to health records during natural disasters like Hurricane Andrew, which devastated South Florida in 1992 and wiped out the medical records of thousands of Floridians.
But when electricity is out for 2 or 3 weeks, sometimes a month, as has happened to us even in the recent years, we can't hook up those systems. We have no way of getting those results unless they're connected to something like Florida Shots.
I really didn't have that much experience with immunization registry. I knew it was a national movement afoot, and it made some sense to me, but Katrina brought it home.
Julia St. Petrie is a Tallahassee pediatrician who used Florida Shots to link immunization records of families who evacuated their Gulf Coast homes because of Hurricane Katrina.
So when that child came over here and was trying to get into school because their house had been devastated and they couldn't go back for at least 6 months and they didn't want to miss school, we could call their state registry and get the immunizations. And that's when it really hit home with me how wonderful it is to have a central registration database.
While Florida Shots can help deal with natural disasters and medical emergencies, many families still face a financial challenge when it comes to getting vaccines.
Especially in primary care in this country, I see more uninsured children now, or underinsured children, than when I started.
It's an undue, unfair burden on a parent who does not have the money to pay for vaccines. Some of these cost hundreds, more than $100 a piece.
To help ease that burden on parents, Congress created the Vaccines for Children program in 1993. The Florida Vaccines for Children program began in 1994, and since 2005 has distributed over $100 million worth of vaccines annually to private physicians, hospitals, and other public and private healthcare providers throughout the state.
Close to 50%. It varies. It ranges around 50% of children are eligible for vaccines for children. So we're talking about a huge number of kids. You wouldn't think that.
Children up to age 18 are eligible for the Florida Vaccines for Children program, provided they meet any of the following criteria: are enrolled in Medicaid, have no health insurance or insurance that does not cover vaccinations, or are Native American or Alaskan Native.
Vaccines for Children has helped poor children because whether they have Medicaid or no insurance, no health coverage, no means of paying for vaccines, they can get their vaccines.
For patients, the Florida Vaccines for Children program eliminates cost as a barrier to vaccinations. It also allows patients to receive vaccinations from their established primary care physician, and it works to improve overall public health and safety. The Florida Vaccines for Children program provides a number of benefits to providers. It allows full vaccination of all children. It maintains continuity of care with patients regardless of financial status. It increases vaccination rates and decreases missed opportunities. It also does not impact private vaccine purchases. Together, the Florida Vaccines for Children program and Florida Shots enable providers to give the best care to their patients and remove financial status as a roadblock to good health. Enrollment in Florida Shots and the Vaccines for Children program is free for licensed providers and can be completed online at any time. Just head to www.flshots.com for Florida Shots and www.immunizeflorida.com/VFC for Vaccines for Children.